All right. Well, that was a nice video. You ready for me to dive in, Dr. In? All right. So, if everybody can hear me okay, my name is Dr. Chris Kleronomos. I'm an integrated medical provider, and I am currently the president of the American Ape Society. And Dr. Sherman has invited us to talk a little about bee venom. And we have a special guest, Dr. Maria Gussak, who is a naturopathic physician and also a board member of the Apitherapy Society. For those of you that don't know, apitherapy is a sort of broad generic term that encompasses everything that comes from the honeybee hive, all the products, propolis, royal jelly, honey, and the bees themselves and venom. In terms of biotherapies, it's really the venom that falls under the biotherapeutics category, whereas the rest would fall under more of sort of herbal or nutraceuticals. So unfortunately, you're not getting the cute, fuzzy service dogs and horses today. You're getting the bees, but that's okay. It's very cool. I think some of you may have seen previous lectures that we discussed sort of the science behind this. And we can dabble into that more. To introduce Dr. Gussak. And so even though I practice Oriental medicine and natural medicine, I'm tend to be more Western, and there's many different styles of how to apply apitherapy: live bees, injectable, micro stinging, an acupuncture model, an Ayurvedic model, and all these different things. And Dr. Gussak has some interesting experience and perspectives on this. So I am going to let her introduce herself, and then we will dive into the interview. Take it away, Maria.
Okay. It's Dr. Maria Gussak. I'm a naturopathic doctor. I graduated from Bastyr University. I got my undergraduate degree at Rutgers. I double majored in philosophy and cell bioneuroscience. And I started my practice just back in 2020 because I graduated during COVID. And so I started out as a house call doc, and I just got a small office right next to this world, adjust to our environment as the honeybees do and do our best. So the first Charles Maraz course I took, I can't remember the year, it may have been 2016 or so. And that's when I met Dr.
Second. There
Okay.
we go. All right, we're back. Having studied both, there is really different perspectives, right? Historically, we had a lot more coming out of that energetic meridian model from classic Chinese medicine. Obviously, in Ayurvedic, the traditional Indian medicine, they utilized more of that system. Currently in the West, we use biomedicine, but I think there is a place for both. Even some of our prior members and presidents used sort of that combination, right? A few of them were from Europe, France in particular, where they embrace that energetics, right? With herbs, homeopathy, etc. So can you tell us a little about how you would approach it, and how you would, how does somebody come to you for bee venom therapy and why?
So I also have to preface, I'm from Europe, I'm an immigrant, so maybe that's where that kind of comes from. We always go to our nature,
Yeah.
And being country folk, you didn't always have a doctor and a, fancy city biomedical thing to look for. And so you look for things in your garden to try to help you out. And so there's kind of a twofold answer. There was what I did before I had a medical license, and then what happened after I got a medical license, right? So I remember while I was in school, I was open with my cohort about my use of bee venom therapy. And I had started Be the Medicine Student Club, and many people were interested. We wanted beehives. There's a lot of logistics, right? A lot of people are scared and terrified of honeybees and having the hives around. And I So that was one portion, and people would come to me because they said, hey, I have a family member who I've heard bee venom can be really good for Lyme or neuropathy or pain, right? And so they would ask my personal experiences. And I did come back with a little summary from our Charles Mraz course on the biomedical and would share that information, right? So I'm not very good at spitting biomedical stats and facts out. My brain doesn't work that way. And so I would give people the readings. I say, here's what I read. Here's the latest monograph. Here's the latest review article. Here's what to type into, your PubMed to get, what you're looking for. For example, people would look up bee venom, but don't realize that maybe I needed to look up Apis mellifera or melittin and a certain disease, right? Like those are the little cues that you can't get unless you're in the field, right? And so, because I kept hearing all these things about there's no research, and it was completely not true, right? We as scientists are trained to search for things. That's exactly what we're good at, So that was one thing in school. And I remember I was out in the country, and this poor man was disabled with back pain, young man, and he just really struggled. And he asked me what I had done, because I somehow lightly mentioned how I had been severely disabled myself. And I do this weird thing, but I don't like go around and tell everyone. And I said, are you sure you want to know? It's kind of out there. And he was just so desperate. And I said, well, I'm not a doctor. I don't know if this is right for you. And we stood in my living room and I gave him his testings kind of, as the lay person. And, I had my forms that I got from the course, like, here's your BBT sessions. Here's the things we learned to watch out for as contraindications. I taught about healing crises and what expected or unexpected reactions might look like. I said, I'll call 911 if something happens, right? Like we went through the whole thing as a layperson. And that man is working more than a full-time job and back to work and taking care of 2 houses, it just like completely has his life back and does this kind of like secret thing, that helps. And then he brought another friend, so it kind of like started like that while I was in school. The Medicine Club didn't quite go very far, but everyone kept knowing me as the bee lady or the bee queen bee, or, oh, that's the chick who does the bee venom. And I said, there's more than just bee venom. There's propolis and honey and, royal jelly and pomodoro. There's all kinds of weird things out there. The remedy, the homeopathic remedy, right? So then while I was in school, I came in from my first year of school with this lens of looking for bee venom in naturopathic school, right? Or the application of apitherapy. I was lucky we got to use a lot of honey in our botanical medicine lab. And then I came across a case in one of our books, and it was one of Dr. Mitchell's cases, and it said how he put bee venom and this lady was miraculously healed on something, right? So I thought, wow, it's here.
Can I interrupt you? For those of you who don't know, Dr. Bill Mitchell was a pioneer of naturopathic medicine. He helped found the school. He formulated a lot of our education. So he's sort of, I don't know about the absolute grandfather, but he's certainly one of the core naturopathic people who brought it to America and made it popular. So go ahead.
Yeah. And so when I saw that in our textbooks and I started seeing, this application, I realized that this is a medicine that's been around for a while. So then while I was waiting for my license, I was wondering, how do I do this? This is kind of, not that it's uncharted territory, but it's different for a provider with a license. There's a different set of weeding out that I do, right? So, and I use that because that is important, right? Not all therapies are great. And bee venom therapy is a great example where patient selection is half of the success in it, right? We need to choose the right person for it. And that also means even if you find the right body for it, it doesn't mean they're at that place in that time in their life. It may not mean that their body's ready for it. Maybe they need some prep work or diet therapy. Maybe they need a lot of education about what does it look like to have bee venom therapy, right? So what I did for my practice is I have a apitherapy consult that's completely separate from anyone else being the usual naturopathic medical practice. And the consult is where I do the usual intake. I get a lot of information about the medication, supplements, what have they been doing, medical history. So far, sometimes people will find me on a video recording or a blog, right, that was on American Apitherapy Society. Other people find me because my name seems to be getting out there slowly by slowly. And so they say, oh, send them to Dr. Gussak, you know. And as I look through it, then I'll talk to the person. And with COVID, it's been half and half has been telemedicine, which is hard energetically to determine things. And then the other half is in person here in my local area. And what I look for is, well, a few things. First, I check for contraindications. That means being on immunosuppressive therapy, not a great one. I'll give an example that like I don't know how real this interview will get, but I'll just say it. Like I had a prospective patient hang up on me because they didn't agree with my take, you know, on bee venom therapy. And what it was like a meet and greet and said, I want to eradicate Lyme disease. And I said, it doesn't work that way. It doesn't work with just bee venom to go do that. And they were very irate and hung up on me, right? And said that I didn't.
Experience.
You have, yes. So that's what I mean by a weeding out. And now I have to say, this isn't that that person was bad or anything. If you had gotten me 3 years before my first bee sting, that actually would have been my reaction towards someone as well, because I just was so desperate and willing to do something. And before naturopathic school, I did not understand the inherent healing mechanisms of the body, right? I couldn't respect that. I had this idea of things need to be eradicated and killed and reduced in number in order to work. Like that was my thinking, right? Well, and it doesn't work that way. You know what I mean? That's not how the body works.
So can we pause there? Because, you know, you've said a couple things that I find interesting and can relate to. You know, often, especially when we're dealing with these things, whether it's bee venom or maggot debridement therapy or you know, herudotherapy with leeches, you know, one, we're overcoming an image, number one, and two, you know, I tend to kind of say, like, often people who seek these things out from me, from you, from whoever, are kind of the last ditchers, right? This is all they have left. This is now what has to happen. But the expectation isn't always excellent, right? People, when they get, and this is totally understandable, as you know, Maria knows, and Dr. Sherman, I have chronic pain myself. I ended up in pain management, but for whatever that's worth. But you know, there's a desperation, right? Because you're tired. There's a mental fatigue that comes with this. And so people almost want this magic bullet, you know, treatment, whatever it may be, right? And in bee venom in particular, we see that often. Like, I have X, I saw on Facebook or whatever that this is going to be the thing, and this is how you have to do it. And I think you brought up an important point, is that regardless of whatever biotherapy, in this case, that we're implementing, there is still a whole person, right? And that has to encompass diet and risk reduction and maybe a nutritional support or a specific targeted herb IV, whatever that goes with that, right? We have to balance it against their medications. What's the benefit? Is the benefit going to outweigh the risk? And yeah, it can turn people off. And it also, when people are so far along in their dis-ease state, if you will, you know, it makes it harder to treat, right? Dr. Tibbet's watching, and she treated, you know, super complex wounds that nobody else could treat. I mean, I'm sure she's had a similar experience, right? Like, they wait And now it's much harder to reverse engineer things, regardless of how cool the therapy is, right?
Yeah, that's true.
So can we talk about, I mean, the science is there. Yes, it's fragmented because we're piecing together, when we can translate it, right? Things from historical Chinese medicine and Ayurvedic medicine and modern Korean publications and, Egyptian research and what we do in America, which tends to be more, reductionist isn't the quite word, but constituent targeted, mechanistic, right? So we're looking at the peptide components and those kind of things, but it's fragmented, right? All of those pieces are kind of all over the place, which is one of the goals of AAS, is to kind of try and consolidate that, which is easier said than done, but that's our goal. So, but we don't really often talk about the energetics. So can you kind of take us through what that means to you and what that looks like, and how you would determine what you would do with the bees from that?
Good question. I'm gonna go a little on a tangent too first. So okay. I feel like there's a part I didn't answer in your previous question yet, which is more direct patient selection. And then I'm writing it down, energetics. So one of the things, let's say I feel that someone is safe enough and in a place to do bee venom therapy. Half the time it's been maybe not right now, but in about 3 to 6 months, build up with other bee products of the beehive, build up with propolis, build up with, bee pollen, build up with the others. We don't have to go to a bee venom sting yet because maybe their vitality isn't there. In homeopathy, we call it the gravity of the patient. Like it's not where it's directing your attention to or where your body needs the healing yet, And so that's one. And then the other part is, figuring out if they're not taking certain medications, figuring out if their doctor is supportive of this, would they be willing to take care of their labs, take responsibility, watch out for different things. I also want to figure out, like, what do they feel is health, their goal? Like, what is their goal? Do they think eradication and a negative lab value is the treatment? Or are they looking at disability indexes, right? There's different types of ways that way. And then I also do run in naturopathic medicine. One of my little extra tricks that I found along my way in school was a Carroll intolerance method to figure out people's intolerances. And so when I can figure out an intolerance, one of them is honey. And so for those people, I don't do any of the apitherapy or bee venom because they just are not, it's like a polymorphism that energetically doesn't seem to work for them. And then there's some people who are meat intolerant. And for those people, I'm very cautious about using bee venom as well, because it's like meat is kind of like anything that walks on the earth in this method. So that's one of the other things, right? I look at, have they ever had other reactions to it? Is it one of their intolerances? And then do they have the kit together? So I don't go right from day one, oh yeah, let's do your testing. Like I want to see, did they go get their kit, their safety kit and their EpiPen and their Benadryl and a homeopathic apis I usually give and a homeopathic aconite, because there's a fear and a panic that will happen, so it's normal. It's the feeling of a bee sting. And so now I'm segueing to the energetics. Thinking of what a bee sting feels like. In homeopathy, they're really good with energetics. And what they did was that they were the original scientific method observer, effort to see what various substances do to the body. And so they would take healthy people and, for example, give them a bee sting and watch what happens to this healthy person. And so I don't know about anyone else, but when we're healthy and we get a bee sting, we get red, hot, there's a local swelling, there's like a poofiness, right? The quality, there's a kind of like a doughy poofy quality. There's a busyness, there's an intensity, and there's like I don't know, like a very high vitality type of state, right? And so I look for that. They say in homeopathy, whatever you show in the healthy patient if there's someone who's sick, that you give them the homeopathic dose. So rather than a bee sting, you give the diluted dose of it, right? So there's some people who are homeopathic apists constitutionally. And I found out I'm one, right? Like I like naturally tend to have very red skin, and like by my unhealthy state, I get very doughy and retain water a lot. I feel inflamed like a balloon. I feel like it's just going to burst. I'm very busy and vital, especially when I'm out of balance. Like I mobilize. I need to defend. I need to, it's very, I'm intense, and I've been described as intense. Like, calm down, right? And that's what I look like out of balance. So for me, that's maybe why the bee venom is a really good fit. And so I look for that. I'll ask a patient, what are you like when you were in your pattern of defense? Someone offended you. You were in a stressful time in your life. What did that look like? And over and over again, the ones that I find that do best with the bee venom therapy have a similar constitution where they're the CEO types. They ran a whole company and kids and they had this intensity, yet there was such an inflammation, but it wouldn't stop them, right? And so they were very busy individuals. And that usually tells me that, well, that means that the high dose would work if the homeopathic small diluted dose would work. It's kind of one of those dose response relationships that happens. We don't talk about it much in pharmacy. Actually, that's one of my little biomedical things I do like talking about. And so that's the energetics, right? So if someone is like that, not when they're sitting in front of you though. When the patient's sitting in front of you, they're so depleted and tired and pale, and they don't look poofy. It takes some clinical investigation to find out the true nature of what that person was like before they were so devitalized. The other like energetic, I like to think of Ayurveda, and Ayurveda is the traditional Indian medicine. And in that medicine, a bee venom or bee sting is very pitta, and that means it's red, hot, swollen, intense, almost the same type of things. And so when I find someone who is a pitta constitution and has gotten so out of balance that maybe they just don't feel like themselves anymore, that's actually one of my clues. Like one of my goals I try to counsel towards is, how do you know you feel more like yourself or like you ought to? That for me is hell, there to feel the way I ought to. And so if it's a pitta person, I'm also more comfortable giving bee venom therapies. And that means for pitta conditions. So pitta conditions are things like rheumatoid arthritis and MS and so very violent, intense, shaky tremors, right? Like chronic pain, the type of pain that has a stabbing, lightning. Whoa, what was that? It's a different pain than a dull ache and I just don't want to move it, So that's kind of where my energetic thinking goes.
It's interesting because that's actually very consistent with Oriental medicine or East Asian medicine, whatever that phrase is. The classical Oriental medicine would classify venom actually as in the herbal energetics, right? Hot, toxic, yang, for those, yin yang, it's the more masculine, more aggressive energy. But what's interesting is later, if we reverse engineer kind of the biomedical stuff onto the energetics, we know that it's this yang, toxic, energetic substance that actually treats what we call all the yin organs. So all the like vital organs of the body that tend to be the most important. And, we can kind of go through the biomedical aspects from, like you were saying, a pitta condition in pain where venom locally does diffuse noxious inhibitory control like capsaicin and gating mechanism like acupuncture, right? From that to the immune response, right, where we might be balancing the immune system, but classically, and treating like, say, an osteoarthritis, right, which classically would be damp. So you're adding a warm substance, right? So there are these correlates between the energetics and the biomedicine. substance to mechanism, right? The how we define sort of these traditional medicines previously were really just lack of vocabulary, right? It was an observational medicine, right? And we didn't have that, right? We didn't have microscopes. We didn't have the ability to mass spec something. But if you really look at what does X, Y, and Z do, and you can kind of filter through that traditional vocabulary and make it a commensurate knowledge, they do match, right? So doing something energetically or from a classical, maybe eclectic naturopathic approach versus a biomedical approach is really doing the same thing. It's just a model of how you're applying it, right? An acupuncturist is going to apply it different than an Ayurvedic person, than an MD, right? But the end result is likely very similar because whatever paradigm you're using is still utilizing those principles, right? So what would you say, to kind of dig in further, what would you say your most frequent request or patient that wants to undergo Venom would be? Like, what would be your most frequent application?
You mean condition wise?
Yeah.
Rheumatoid arthritis. I think herpes is the next one. I keep hearing herpes is the next one. Yeah.
Like active or like herpetic neuralgia type?
Recurrent herpes. Yeah. And Lyme.
Okay. Yeah, that's pretty interesting. I think, for me, obviously people seek me out for pain. So a lot of rheumatoid, Ehlers-Danlos syndromes, those hypermobility syndromes, some Lyme and chronic infections. And we know there's mechanisms for that. We know there's good increase in immune surveillance. We know there's increase in T helper cells and T regulatory cells. So, and we do know that it's effective against gram-positive and negative bacteria and various viruses. That's all well documented. Can we prove this is going to cure X? No, probably not. A lot of it's in not in the body, human studies, right? It's in scientific research studies.
Real quick on that, this idea of cure is complicated. So which audience are you asking? Are you asking a conventional mechanistic person who says, oh, there's no more symptom? But are you going to ask someone like me who says, well, where'd it go then? You know what I mean? Like, which one is it? So for me, a cure would be when the patient finally has a really big discharge, fever, stays, they were at home in bed for 2 weeks, and that's what we were working towards. And we were counseled on this healing crisis that we were working towards, because then the body was ready to finally mount the immune response it needed to treat whatever it needed to do. And then they wake up and they're like, oh, I feel great, right? So that to me is a cure, right? Like a curative. And then maybe it has to be a couple times whenever the body's ready for it. So that's the other hard part is, not everyone's willing to go through a healing crisis, right? What is cure? And that's why it's one of my important questions. What does cure mean to you? Is that a lab value? Because I can do other things to change a lab value. You know what I mean? Or is it that you want to go back to work? And I am very lucky. I tend to get most people who are like, I just want to pick up my kids and keep working. That's one of my big ones. I want to have a good life, so it depends.
Yeah. And that is interesting. And for the people at home, I just want to circle back, when she's talking about healing crises from the Venom, in a sort of reductionist Western model, I'll try and explain, we're really inducing either a strong immune response, which tends to coincide with this large inflammatory response, or we have, in theory, killed pathogens that are releasing toxins in their death that do the same thing. And that's what we see. We see these stages and this period where we have this very robust response that is not, well, let's say it's less than awesome to experience, but it is what we look for. And it's why it's somewhat complicated. And there's a difference between a layperson approaching and a naturopath, an MD, an ND, whoever is doing it, because we tend to see people, so I said I do a lot of pain. You mentioned immune suppressants. I do have patients that I initiate Venom on who are immune suppressed. Not my favorite, but when we're out of options and I feel like at least they're compliant enough to, they're on their diets, they're doing whatever else we're doing for immune balancing, this is the next step. And I will say my experience is we don't often hit we don't hit a healing crisis almost ever, even at 20, 30 stings. So it is interesting. And again, there's that correlation.
And that's an important thing. Like, you can use bee venom in different ways. You can use it to overcome something and have a healing reaction, or you can do it as a palliative. And both are medicine, that it doesn't mean one is worse than the other. It just means, like, do we know what we're doing this for? You know what I mean?
That's a really good point, because so for myself, I've done both Venom as a classic approach where I'm stinging, acupuncture points, etc. And for those who don't know, I just had to have a surgery because I could not get my back under control. But I did treat it for almost 15 years. I did a lot of damage in the military. Who knew? No, somebody knew, just not me.
Thank you for that.
Did a lot of damage, but the Venom made me functional for close to 20 years until it didn't. And then I had to transition to a Western intervention. But to illustrate this point, right? So I had the surgery, MRI looks improved. Is my pain that much better? Not so much. So the surgery was a success, but that was not my goal. I could have maintained my goal with the Venom, because my goal is to be able to go do stuff. And in the past year, I have not been able to go to the gym, go to the dojo. I was a martial artist, right? So for me, it was a failure, even though it was technically a success, right?
It's so true. And the same thing happens with, like, the rheumatoid and osteoarthritis patients, that they want this radiology finding to change. And I said, at the end of the day, it doesn't matter, because we know now, right, that you can have someone with a severe osteoarthritis on imaging, yet it does not correspond at all to pain level and disability. But someone with almost nothing can be completely on disability and in excruciating pain. Yeah, so, like, again, what are we treating? What are we using it as? And sometimes we have to take breaks in it. I know I've used bee venom therapy as, okay, this is my my 3 to 6 month retune overhaul, right? Every couple of years, right? And then let me get my body back on where it needed, but I need to work up to that. And then other times it's just as needed for certain things, or maybe certain trigger points, and I didn't feel like getting a massage yet, like something like that. Or maybe I'm energetically going through something and I can find acupuncture points to help me support through that too.
Absolutely. Let me just check in with Albert there. Are we doing okay on time? Do we want to transition to questions? Where are we at, Albert?
I'd say we're doing okay on time. Dr. Sherman, oops. There you are.
We have 15 minutes left.
So do we want to maybe do some questions, if there are any?
It sounds like this might be a good break time. Let's ask. Any questions?
Yes.
If so, unmute yourself. There's a small group today. You may unmute yourself and ask questions. And in the meantime, Albert will check the chat box for questions.
Perfect. Yeah, it's an interesting subject overall, and I hope we try to have these lectures all the time, and we specifically did this from a different angle today in this sort of more dynamic interview style, because it's often the piece that's missed, actually. So the people who are here today are probably getting something that usually we kind of gloss over when we're teaching, because we're trying to deliver this core information, everything from safety to the where to get the supplies, to conditions, to contraindications. And so this sort of, discussion doesn't happen often. So I hope it's been interesting for everybody.
It's been very interesting. It doesn't happen enough, that's for sure, because this is really the practical elements, what is it really like to put it into action that is not, as you said, not normally possible to delve into during a lecture or a more academic course.
Right. Do we have any questions, or should we just plug away?
Uh-huh.
I don't see any questions in the chat box at this time.
Well,
Wow.
what if I talk about, let's pretend that I chose someone who's a good candidate for Venom therapy, right? So what do I do?
Great idea.
So usually that's where I have the second appointment. I have found that I just include the second appointment with the first, because when I get my first appointment and someone in front of me, I have an anxiety, right? Like I'm kind of I'm trying to impress you, right? I'm not thinking I think differently when I'm removed from the situation. I go home, think about it, make sure there wasn't something I missed. And that's also kind of where I get a lot of my intuition from, right? And so with the second appointment is usually where I give my conclusion. Sometimes the conclusion is very clear, but it's just one of my things where I've learned to hold off and wait. For example, the desperation might change my clinical feeling during an appointment, right? Maybe afterwards when I go home, I'll say, man, I got to make this work somehow. This is different, right? So my thinking's clear. So one way that I've done is the in-person, right? And now we're in COVID, so there's the telemedicine version. Telemedicine, I have done with it. I require that a second person is available. They understand that I will be calling 911. I get their address, and they already know how to administer. I go through how to do an EpiPen. This is a big one because not everyone know how to do it. And I literally will stand. So I'm going to stand and I say, take your EpiPen and go like this, and have your thumb over like a punch. Do not put it over. And just little things. And I say, can you please show me? And then so we do a testing via telemed or in person. I wait the full 20 to 30 minutes. I'm talking to them, keeping it light. I'm not staring at them like in a scary way. They'll tell you if there's anything. And usually the patient's asking different questions during, to kind of keep themselves calm while they see what happens. And then the testing's taken out right away, and it usually is repeated if someone hasn't had the therapy for a while. And then what happens then is they're like, well, where do I stay here? And I try to teach them here, let's learn some acupuncture points. Let's learn trigger point therapies. There's this is an art, there is no science protocol. And there's going to be someone out there who is like, there is a science protocol, and that's fine. Whichever, whatever the patient responds to, right? And I tend not to do as many stings as I find others to do. I tend to be more on the lower part, and I tend to not supersede the body's mechanisms. I think of Venom more as a little flag, right? Like an acupuncture needle, like at that level in my brain for some reason. And so then I go through with how I keep bees and how I catch them, because more of the conversation is very practical. How do I feed them? How do I keep them? And I've gone in with my truck, which I have a house call truck because that's what I had to do. And I'll go up on their farm, and I found like a bugzooka on Amazon that just sucks in. It's supposed to be to suck in spiders, but I suck in bees that are out there pollinating in their orchards, and I show where to grab them with the tweezer. In a camera, I would do it just closely. So if I had a tweezer, I don't always have bees in the office ready to do, but I try to do it with them. That's something else that's kind of nice. And so when I grab a tweezer, I do bring it up to the camera, and that's why I got this special camera system, so I can show the anatomy of the honeybee. And I'll show, here's where the bee is, here's where I grab, and I'll say I grabbed it with the right. So I kind of show this dexterity, have them practice a little bit with me. And then I show them how my setup is, whether it's in a jar or a mini butterfly terrarium. Those are my other favorite tricks I found. So I'm going to show that. So like I do a jar and a toilet paper tube, the old Charles Mraz style. And then on top, you can get it from like your coastal or farm store, are the little mesh screens that usually you use for like window screens, and a rubber band. And that's really easy. And then other versions are, I use like a kid's butterfly terrarium, you know, and then I cover it with a tea towel. And because I kind of felt bad for the bees and I wanted them to fly around a little, but I tried all kinds of different things.
Sure.
And then a big question that comes up is, what about the bees dying, and what you do? So I saw one practitioner who, when she uses the venom sac from a bee and she puts it into a cup of water, right? And the bee drowns in a quick death that way. Others have a special Japanese tradition of taking the bee and, giving it a mercy kill. And there's a prayer and a spiritual practice with it. For me, if I have not taken the entrails out with the bee sting, which takes a lot of practice, if they have not, I'll put them on a flower because they stay alive for a little while longer, and I see them later and they don't have a stinger and you can show them to kids, right? But if they did lose the entrails, then I maybe do something different. And so those are the more practical questions. And what do you do if it's really itchy? When do you take Benadryls? Can you do a potato poultice? Or I get the questions of, can you do a sauna and a coffee enema and a baking soda bath, the day of? Like, I get a lot of those practical things because the bee venom sessions typically are 2 to 3 times per week, some people more. And so they wonder how to balance it with their other therapies.
Yeah, no, that's good. And since we're on that subject in the practical, I just wanted to throw this out to the audience and make sure it was recorded, that in general, right, bee venom therapy is actually quite safe. There's, a less than 4% ranking of true honeybee allergy. It's reported in the literature a little higher, but when we adjust for inaccurate reporting, wasp, yellow jacket, bumblebee, hornet, right, it actually goes down to the 1 to 2%, little higher in people with maybe eczema, asthma, those kind of things. But there has been no recorded deaths, even from lay people. There's been one in the past 15 years that's been reported. And that was actually an error. The person did not have emergency equipment with them. So it was a preventable death, unfortunately, which is sad. But, there are thousands of people doing this, if not millions, all over the world daily. There's even a few years ago during the Palestinian crisis, when they were very short humanitarian aids, there was a Palestinian doctor who had trained, I believe, in Egypt or Iran, I can't remember, who was really just utilizing bee venom and hive products in the refugee camps because that's all they could get. So, it is very safe in general, but, of course you want to be prepared for the worst, right?
Exactly. And so here's a little, if I were to have a self-admitted agenda for today, the only thing that I wish I could plop in here, like I said, it's different since getting a medical license, right?
Sure.
So that means that the discipline of iatrogenicity applies to me as a medical provider, because I can do harm, whether I meant to or not, whether I'm practicing good medicine or bad. Iatrogenicity is an inherent part of medicine. So I'm biased because it was my father's labor of love. He retired as a scientist and said, now I'm going to say what I really have to say, right? And so he wrote the book, and I got to write the first introductory chapter to it. And we sat together with the Dean of Rutgers, and we decided on what the definition of iatrogenicity is for us. So I'm going to read it real quick because it's an interesting one. It's not just medical harm and all the malpractice things, but it is any intentional or unintentional, immediate or postponed, yet preventable or avoidable harm to the human body or mind or pocketbook, actually also too, by either action or inaction. The failure to prevent of the medical caregiver, resulting in discomfort, injury, disability, death, or bankruptcy. So those are important things to consider. And so I do tell people like, hey, you know, that is why I like Venom. It's a very affordable therapy when it's selected for the right person. The upfront costs can be high. And yeah, I mean, it's been one of my favorite treatments to use, but it's definitely not the only one that I use.
Sure. Dr. Sherman, Albert, Althea, anybody have any comments or want clarification? Doing okay?
Yeah, no questions in the chat right now.
Okay.
We're so used to getting so many questions, and
I know.
we're a little surprised.
I have a question.
Yeah, go ahead.
Sorry. I'm going to take this opportunity to ask a question then, since there aren't any expressed yet. What recommendations would both of you have for people wanting to find out more about this field? And I'm going to tell you right now that you should definitely talk about the Mraz course because, as you know, I took that course. I had no interest in actually applying therapy for myself or for anyone else, but I just wanted to learn more about the field. And it was a phenomenal course with very experienced, very knowledgeable, very friendly cast of lecturers and participants. So in addition to that, though, what would you advise for someone who's interested in learning more?
Sure. I guess let me start. So, I mean, obviously, aside from joining the Bitter Foundation, the American Apitherapy Society is, we're an educational not-profit similar to yours whose goal is to do the medical aspects of hive products, including bee venom. So not the agricultural part, right? We're the medical part. And we named our annual conference, the Charles Mraz Conference and Course, because he was kind of our founder, sort of popularized bee venom, and in particular bee venom and hive products in the United States. Obviously, that has been a little rough with COVID, and we have not been able to put on a live course in the past 2 years. We are hoping to do so in this coming fall. Historically, we tend to have an initial day where we do an overview of every product so that everybody has sort of a basic understanding of all the products. And then whatever topic the conference needs to be, we dial in the specific lectures for that. And we try to attract guest lecturers from a variety of fields, because again, just like Dr. Gussak and I have different approaches, we have different specialties, we see a different patient population. I have to, I'm in a sort of a multidisciplinary clinic with multiple providers. I can't have bees flying around, so I used injectable. Though I do teach people how to do live bees in the office as part of their transition. So, I mean, those would be the two most basic. And if you join the Apitherapy Society, we do have a lot of past lectures and articles and videos of things like this that are available for people. There are there are other Facebook and social media organizations. I think grain of salt is a good maybe caution for those, because they are not always, some are excellent and have somebody moderating that's knowledgeable and not over the top, but others have sort of interests, self-interest involved, or are a little looser with maybe cautionary things than they should be. So that's the basic place to undergo the initial information. There's also an international group on WhatsApp, for those of you familiar with the WhatsApp, and that's the BioTherapy Society that's run by Dr. Stanganucci out of Romania, who's also one of the, I don't know, probably worldwide proponents of all things BioTherapy. And it's interesting, for that group has a lot of European people in it, which makes it interesting because, again, they can do things, it's accepted culturally, right? It's accepted culturally and it's accepted within their medical system. So they're doing things like a clinic attached to their universal healthcare clinics, and they just happen to be doing Venom, right? On pediatrics and on adults, and right, we can't do things like that. So we get a lot of interesting knowledge, and you hear from all the lay people around the world doing that. So that's the first thing I would say, get a foundational knowledge. And then obviously when COVID allows and we can have courses in person, they are worth attending. We try to be very personalized, and deliver, and meet with everybody and get their needs met. Maria?
Yeah,
Dr.
I mean, I
Gussak,
second each
anything?
of those. Yeah, it's I like reading books, so I got the Charles Mraz. I think that was the first little health and honey book ebook, and I read that. There's like, I went to my school library and read any little bee. There was a couple of books in the bee venom section, like a bee venom Bible. I don't remember the authors. I did the Charles Mraz course. I found it very helpful, and I still continually use that as resources and need to update it. I have to keep listening to things over and over again. I'm by no means an expert after one weekend course. And I'm also kind of like the grain of salt thing. If I hear someone who's really like protocol this and certain things, I get a little skeptical, and I try on purpose to hear other things. And it doesn't mean that it's wrong. It's just, I need to hear at least two different approaches to find out what sits and resonates with me at that time. And the reason is, when I first started it, I was very biomedical. Where am I sticking? Right. I was like, that was what I needed at the time. And I did that for a few years. And then I switched. And part of my process is that I go back and forth, and I get, biomedical, and then I get intuitive, and neither are bad or good. It's just, I want to be versed in both, because wherever the patient in front of me is at, I want to meet them where they're at too.
Yeah, that's great. I mean, multiple perspectives. Like I said, we've said it multiple times. The knowledge is sort of fragmented and out there.
Yeah.
And as much as we're trying as an organization to consolidate that, gaining consensus and balancing, not losing the traditional value that's thousands of years old, but incorporating the Western and teaching it in a way that's broadly applicable is difficult.
Yeah.
Perspective.
Yeah. I also have to add that, I do the BioTherapy consults. It's not a huge part of my practice. Not everyone needs that, it just kind of depends if you want that direction or not. And sometimes I tell people, I'm more expensive now. It's different than before I got my license, like my hourly rate is very different now, or I didn't have one back then.
Right.
And then the other part is that I get weekly emails from NCBI that I can go, and they just like blast me on any updates that are going on. And I find new, interesting ways to use products of the hive, during various situations. And for example, we're going through COVID. So I've been getting a lot of interesting things on viral activity, right? That maybe I didn't pay attention before to.
Awesome. Well, I think we've covered most things, Dr. Sherman, Albert.
Well, that was Yes, I want to thank both of you for spending your time and educating all of us. I want to thank the participants as well for joining. This has been a great session. We're going to try and continue doing this as we have all last year, once a month, generally on the third Tuesday of the month, depending on what the speakers or guests can make on their schedule. But if anyone participating or listening to the program has ideas for other topics or other speakers within biotherapy, let us know, and we will continue to invite guests to join us. Any last questions before we turn off the, or announcements before we turn off the session? If
I don't see anything in the chat.
no, okay. Well then, let me bid you all farewell. Thanks again. Take care.
Thank you.
Thank you.
Everybody stay
Thank
safe
you.
and healthy. Bye.
Bye-bye.